Hey everybody, welcome back to another episode of the Eugene Morning Hustle podcast. Today we're going to be talking about the direct primary care model and how it combines old-fashioned care with modern medicine.
That's right. We're going to explore how it fosters long-term patient care, how it's a more personalized approach to medicine, and it's accessible and affordable to the residents here in Eugene.
Let's get into it.
I had to have the last word. What's up, Eugene? You're listening to the Eugene Morning Hustle podcast, brought to you by the Eugene Area Chamber of Commerce. We're your hosts, Brandon Miller and Ivan Torres, and like us, we know you'd like to know what's going on in your city, socially, economically, civically, and culturally. From events to guest interviews and professional and personal development tips, each week we bring you stories of local business owners, advocates, leaders, and everyday Eugenians sharing how they've strengthened their roots to reach a little deeper in our community and how you can too. Joining us today is Dr. Nick Jones of Clear Health Direct Primary Care. And today he's going to share with us what direct primary care is and how it's an affordable and accessible form of healthcare. So welcome to the podcast, Nick.
Yeah, thanks guys. Happy to be here. Happy to share my experiences, what led me to this point, and more importantly, spread the word for the community that there is access to primary care, probably in a way that they didn't think was realistic or even possible.
Well, could you get into a little bit about what direct primary care is? Like what makes that different versus traditional?
Yeah, so I think a lot of patients and a lot of the community are recognizing that there's increasingly numbers of people and barriers between you and accessing care, right? And one of the biggest of those is whether or not you have insurance, right? When you are talking about automobiles, right? The mechanic doesn't run your auto policy, right? When you're needing a plumber, they're not running your homeowner's policy. They are just there for catastrophe, right? However, with insurance, they're increasingly trying to make it seem like they need you need them to access care at all, even to just see a doctor. Direct primary care cuts all of that out and goes back to the old days where doctors work for their patients. And so with the modern technology and everybody being familiar with the subscription model, patients pay a flat, usually a low monthly fee, and they get direct access to their doctor. That can be through text message, email, phone calls, all those things that insurance doesn't really pay for, right? Best of all, from the doctor's perspective, we get to do what we went to school for, and that's take care of patients, not worrying about billing and coding and clicking all of these boxes to make patients look a certain way to get reimbursed a certain way. Definitely helps eliminate a lot of those mental gymnastics on the doctor's side of things.
Well, speaking of that, how did you get involved in medicine in general, and how did you even become aware of what DPC is?
Yeah, that's a great question. So I got involved with medicine because I remember being an only child in about first grade, kindergarten, somewhere around there, and I got really sick. And my parents panicked. And when you're an only child and your parents are panicking, it's kind of freaky. And when you're normally bouncing off of the walls and getting reprimanded by your teachers and suddenly you're sleeping through class, they get worried, right? But back in the 90s, my parents were able to call off of work, swing by the school to pick me up, and take me to my doctor, right? The same doctor I'd seen for the 5-6 years of my life. I got seen when I needed to be seen, and I realized that's a pretty sweet gig, right? Like, I like science, I like astronauts, I like dinosaurs, let's be a doctor, right? Because you just help people for a living. So then I applied early and got into medical school in the University of Texas, San Antonio. And I love it. I'm also a big San Antonio Spurs fan. So it was a great place to train, great place to learn. And I was one of those medical students that didn't know what they wanted to do. 1 month it was I wanted to be a cardiologist. The next month I wanted to be a psychiatrist in the prison system. The next month I wanted to be a trauma surgeon. And everything I liked was like every single rotation. It was really challenging. But then I had a mentor that told me, if you do family medicine, not only can you see patients in the clinic, but you can see them in the hospital, you can see them in the ICU, you can see them in the, and that's intensive care unit for those who don't know, the emergency department. You can deliver babies, you can do small surgeries. Like, whatever you really want to do, whatever you continue to grow passionate about, you can pursue. And so from there, I did a unopposed residency, which just means there weren't other types of residents I was competing against. For example, when I was delivering babies, it was me and the obstetrician, not me and a bunch of other OBGYN residents in Corpus Christi, Texas, and that was for 3 years. And my wife and I were ready for a change of pace. We had really just put our heads down and, like most doctors, sacrificed a decade of my life and about $250,000 to learn the art, the art and science of medicine, right? And we wanted to change a pace. We wanted to see what it was like living elsewhere. And the Pacific Northwest has been an awesome place to vacation. So we figured, let's try it. It's 2020. What could go wrong, right? So we interviewed in 2019, and I specifically told the recruiters, I only want to interview. I only want to work at a place that's not only owned by doctors, but somebody in the executive team, CEO, chief operation officer, or chief medical officer. Somebody has to be an actively practicing doctor. Right, that means they need to be seeing patients, even if it's just a half day a week.
Why was that important to you?
Well, because it reminds us why we go into medicine in the first place, right? And I wanted to make sure that somebody that's in the room for the big picture decision making is still seeing patients and remembers why we do all of this. I didn't interview at Peace Health or any hospital system because the clinic is just where patients go between hospitalizations, right? When you're a hospital group, that's where you're making your money. You're making your money on the referrals and the procedures and everything that's done in the hospital. I didn't interview at any places that were owned by private equity, whether that's private investors or whatever. I didn't want the C-suite people to be making all these business decisions completely disregarding actual medical practices and best practices. And similarly, I didn't interview for any places that were owned by Optum or any insurance companies like United Healthcare in that case, because there's inherent conflicts of interest. When you're writing the bills and you are setting the pricing that you're reimbursing for things, these insurance corporations, whether it's Blue Cross Blue Shield, Aetna, Cigna, whatever, they're publicly traded, right? They have a fiduciary interest to their shareholders to turn profits quarter over quarter. And the way they do that is not only by raising premiums, but by denying care, by reducing their spending, right? And as a doctor, I don't want to have to think about any of those things. I just want to do what's right for my patient. And if I can, I want to find the cheapest and most effective way to take care of them, to save them money, not the insurance money, right? Not to have all those profits end up on the stock market. And unfortunately, when let me back up a second there. Fortunately, Oregon Medical Group was by far the best, right? I interviewed in Colorado, I interviewed from Sacramento all the way up to Seattle, and there weren't very many clinics that kind of fit that need that I was looking for. But I remember very significantly when I interviewed at some of these other traditional practices, they were taking me to the fancy side of town, right? They'd take you on a real estate tour and show you, oh, this is where all the doctors live. They didn't realize that I had $250,000 of debt, right? You don't want to be getting these new grads and showing them multi-million-dollar homes. Like, that didn't fly. And at Oregon Medical Group, the doctor I worked with, Dr. Maloney, and her husband were fantastic. And their idea of a real estate tour was to take me to hike Mount June and Salt Creek Falls and pack me a sack lunch. And oh, by the way, we'll stop by a grocery store and 2 or 3 apartment complexes near the clinic I'd be working at. It was so much more personable, and I got a good sense of the outdoors, which was a big motivator for me to get out here. And another one of the doctors that I would eventually work with, Dr. Abner Phillips, he ended up taking me to the Whitaker Block Party because I was staying at the hotel and thinking, is there a comic convention? Like, is there something neat going on in town that I need to know about? Sure enough, it was the weekend of the block party back in 2019, right? The last hurrah before 2020. And it was just a surreal experience, like getting a good feeling for Eugene before all the lockdown and all of that. But yeah, I'm happy to be here.
So you ended up moving up here in 2020?
Yeah, we moved up as soon as I finished residency, July 1st, 2020, and my wife and I got married in 2020 also. We were going to backpack Europe, but COVID had other plans for that.
Yeah.
So we started working in mid-September of 2020.
Okay.
And then when did Clear Health come in?
Yeah, so I ended up putting in a 6-month notice. So around April of 2023, I knew, things had gotten to a point where we had saved up enough money that I could take the jump and take the plunge and kind of put my money where my mouth is. And if I think healthcare can be done better, I need to prove it, right? And there's also something that we can get into later, but this term moral injury, right? Not being that doctor that I thought I was going to be, right? Not being able to know my patients. I was here for 3 short years and had almost 3,000 patients. And the national average for primary doctors is 2,500 patients, right? And so when people are in and out of the hospital, when you're booked out for 3 or 4 months and you don't even know how your patients are doing, you're signing off paperwork for physical therapy or referrals or stuff like that, and you don't even know the names of these people, like that doesn't feel like care. That doesn't feel like being a doctor. And maybe some of the old docs that have been doing it 20, 30 years, they've slowly grown their panel and they know their patients and they can juggle that. But I don't think a lot of other, especially younger doctors, feel that sense as well.
Well,
Direct
Clear
primary
Health
care, indirect primary care. Yeah, absolutely. So whereas in 3 years I accumulated 3,000 patients, right? And I want to also get to the systems at play, right? Like why the healthcare system is the way it is, right? And the vast majority of clinics are something called fee for service. That's FFS. And it also feels like the computer speak though, that we know of, right? But that means you get paid for a service that you're providing, which, on the surface level makes sense, but that also means you only get paid per visit, right? And when you need a billing department, a coding department, an authorization department, just to try and get paid for the services you're providing. And then you start throwing in HR, IT, your front desk welcoming staff, your back office call center, right? Your triage nurses. All of those people can only be supported by the visits of the doctors, nurse practitioners, and physician assistants. So you necessitate this model where you have to keep churning through 20, 25 patients a day. Right. And that results in 10, 15-minute visits where the doctor is supposed to, you're supposed to check in at the front desk, right? You're supposed to get your vitals, fill out some questionnaires and stuff that the insurance requires, tell the nurse what's going on. Then the doctor comes in, is supposed to review your history, right? Especially if they don't know you very well or it's seeing them for the first time. Listen to your concerns, develop a plan on what to do. Order any prescriptions or diagnostics like imaging or lab work or referrals to specialists. Summarize the pros and cons, risks and benefits of each of those things that you're doing together, and click all of the different boxes to code it correctly and get reimbursement from it. And give you a summary of everything that you talked about and complete this legal document called a medical note in 15 minutes. It's absurd. It is absolutely absurd. And the thing that actually matters, in my opinion, is the connection, right? Is being able to explain what needs to be done, being able to answer questions that patients have, being able to have time for the patient, right? To fit them in when they need to be seen, to answer their questions when they need to be answered, and to teach them, right? Teach them what's going on, right? Some of these patients, when it's a new diagnosis or it's a chronic disease, that time that you invest in patients is what can make a direct primary care practice successful. So to circle back and answer your question about, how is it different, right? Direct primary care, because it's the subscription model, it doesn't matter how many people you see in a day. It matters about the quality that you're taking care of them and the time that you have for them, right? So being able to squeeze them in same day for something urgent, right? Being able to spend an hour with them to teach them what is diabetes, right? What are these medications? How do they work? What does your nutrition and lifestyle do? Here's a Here's a continuous like blood sugar patch that you can put on and show us a minute by minute trend of what's happening to your blood sugar in your body and how we can use that data to adjust your nutrition, your lifestyle, your exercise, all those types of things. And the healthier the patient is, the less often they need you, and you can help get them healthy and reach their health-related goals so that you can have more patients, right? And you can literally build a community of patients. And so the incentive there is to get patients healthy.
Versus keep them.
Versus see them as often as possible, right? Or there's another method that people are trying to push towards called value-based care. And this is this concept where doctors have to prove that they're valuable, right? You spend multi-million dollars to get a medical record system that can track what percentage of your patients have a blood pressure over this cutoff, what percentage of your patients have blood work over this cutoff. And if you can reach these thresholds, then you're good, you're going to get a bonus. But if you don't get those thresholds, you're going to get penalized, right? And that takes the uniqueness out of each patient, right? It could be a patient who hasn't had access to a doctor, lives in a food desert or rural America, and has had their diabetes off the charts high for years. And this is the first time that they've brought it down. But if it's above that threshold, it's a ding against that doctor, right? They can have questionnaires, satisfaction surveys, right? There's a 4-month wait to get in to see my doctor. Oh, sorry, doc, that's a ding against you, even though you have no control over your schedule or how you're taking care of patients, right? And so that value-based care, I think, is a joke. I think it's absurd. I think it's a way of insurance companies trying to make doctors do more with less just to try and get the same level of compensation, which is horrendous. Instead, again, I'm going to circle back. The thing that I think truly has value is having a doctor that knows you, that can see you when you need to be seen, and can give you advice when you need advice. And so that's why at Clear Health Direct Primary Care, the way I like to explain it to patients is that they get as much of my time as they need when they need it, right? Some months it might be 5 minutes just for some prescription refills. Other months they could be in and out of the hospital, and I spend like an hour visit with them 2 or 3 times in a month. Same flat fee. Right? And once patients reach their health goals, well, then they have an on-call urgent care that knows their history, that knows what it took to get them healthy in the first place, right? And that in and of itself has value. Yeah. And so for me at my practice, we charge $100 a month for adults and $50 a month for students and children. And for full-time students, we maintain that $50 a month rate for a whole year after they graduate so that they can find employment and, build up that emergency fund and invest in their health.
So you mentioned call, text, email. They can reach out to you anyway. Do you do house visits?
Yeah, so I do house visits as I deem medically necessary. I put on my website that it's a $200 an hour charge for those that, I just didn't want people to abuse it. But within town, I've done a couple of nursing home visits, right? I've seen what it takes if somebody's in a wheelchair, right? Like it takes a village of people to bring them into the office, right? Why don't I just swing by and see them at the end of my day, right? On my way home. Like that's just so much easier for them. And the other benefit of the direct primary care is keeping simple things simple, right? If I could just talk with them on the phone, right? If they're having a side effect to a recent medication that we did, why do I have to go to them? Why do they have to come to me? Why can't we just have that conversation with their caregiver and them together, right? Review some vitals, ask them to send me a picture of their blood pressure like every day for, a week, and then make the adjustment that I need, right? Like the reason why a lot of these homebound patients have to go into the office is because that's what Medicare necessitates. That's what the insurance necessitates. You don't get paid otherwise. Luckily, this deal about telemedicine has really improved access for a lot of patients, but I think that's going away within the next year, and it's up to Congress to renew that. And I don't know that I have much faith in federal congressional action to move the needle in the right direction, but we'll see.
So a second ago you were talking about getting scheduled out, months and months and months ahead, and I've personally had I was feeling sick today, but they'll see me in 2 months, so I'll probably be fine by then, hopefully.
Yeah.
But what does that look like with your clinic? How far out are you usually scheduling? Is it a couple days ahead or?
Yeah, so that's a great question. If it's urgent, today, tomorrow, right? Like I purposely start my clinic at 9 a.m. so that I can squeeze somebody in the morning around 8:30 if I need to see them the next morning, right? I end my day at 4 p.m. so that I can squeeze somebody in at the end if they call during the day and they need something, right? And if I think it's medically necessary, I'm going to see them on the spot, right? But if it's routine stuff, patients can schedule, I think, 48 hours in advance, and they can schedule their own appointments on their own online portal. The subject to availability is there, right? I'm very politically active. I'm going to a medical conference this weekend, actually.
Nice.
And I'm going to a lifestyle medicine conference at the end of October. So there's times where, I'm not in the office, but I'll have virtual office hours, right? Shoot me emails, shoot me texts. I'll send a message to my patients and say, hey, if you need something seen within the next 2 weeks, like come in now, because I'm going to be gone next week and I can't physically see you. And they can go to urgent care or other places like that, but they'll at least get my advice within 24 hours while I'm out of town or something like that. Until I hire a new partner, right? Eventually that'll be in the cards.
What's the team like now? Is it just you?
So it's me and a lovely medical assistant. Her name's Shaylin Guzman. We're the face of the practice. And so when I'm busy with patients, she's available to take calls. She's the one that hunts down referrals. If a patient hasn't heard from a specialist after we referred them, or if they are out of a certain prescription at one pharmacy and it needs to go to another, or if the insurance doesn't want to cover things, right? She's the one getting online and helping to appeal those sorts of things to help save our patients some money. And it almost lets me be in two places at once, at least as far as communication with patients is concerned. And within the next year, or early next year, my wife's going to start working full-time. And
that's awesome.
Oh, nice. Very cool.
Yeah, she's a family nurse practitioner. We've been together through her nursing school, my medical school, my residency, and moving up here. And we work pretty well together as a team, and I'm excited to be able to allow her a panel, not necessarily a panel, we're going to share patients, but I'm going to allow her to specialize, right, in the things that she enjoys: dermatology, mental health, pediatrics, and help me grow my community in that way. And she can follow up with those patients on those needs, because I know I can vouch for her that she goes to these conferences and takes the extra step to learn about these different things. But in the traditional practice, right, where you're just doing as many patients per day as possible, it doesn't matter what the conditions are. It doesn't matter if that nurse practitioner is fresh out of school or it's a PA that's never done, that a certain rotation in that specialty or whatever. As long as they can bill, right, then they're part of the team, right? And I think that it's very important to have team-based medicine, where you have a doctor that has the broader scope of practice and has experience in all specialties, at least superficially, and they can help coordinate and identify the strengths and weaknesses of their team, right? Whether that's a team with nurse practitioners, physician assistants, registered nurses, medical assistants, and helping to make sure and overseeing the growth of the practice or the growth of the community, and making sure to take the time to teach whenever there's an area that they could continue to learn in. And that's kind of an ideal way of thinking about medicine, but right now I know a lot of docs that are just struggling to get through the day. And that's where I felt like I really wanted to take the time to optimize and improve like the way people access care and the way care is delivered. And I'm so happy with how well it's going so far.
You mentioned something interesting here a second ago. You said when insurance isn't trying to pay. So do you guys take insurance?
Yeah, so great question. I can use insurance for expensive things, right? If you need it for an MRI, if you need a referral to a specialist, if you need it for expensive prescriptions or blood work or whatever, we can use insurance, right? But my time, whether you've got Medicare, Medicaid, commercial insurance, no insurance, you're undocumented, everybody pays the same flat monthly rate, right? But something that a lot of patients equate is insurance to care, right? But it's not. It doesn't guarantee access to care, right? I'm sure many of the listeners here have tried calling around to find out if there's a clinic that takes their insurance, right? And they can be turned away easily, or they can be told that their appointments are months and months out, right? One thing that I think is enlightening for the listeners to know is that I can get prescriptions. We have our own pharmacy. We can get prescriptions, generic at least, for 2 or 3 cents a pill, and turn around and sell them to patients at cost, because we don't need to make a profit on that. We're making a profit off the membership. Blood work, you can get blood work for $3, $4. I think the most expensive test I do is $20. And that same exact vitamin D test that I can get for $20, I had Medicare deny on a previous patient, and it was $262. I have another patient who the lab forgot to bill it under my account, because I pay for the blood work for my patients. I have like a running tab with the labs. And the patient got a bill for $572 for an annual panel of blood work, including some basic things like for diabetes. So, the blood sugar, the kidney function, the cholesterol, the 90-day average blood sugar, and a urine test. 5 tests ran $572. Once they put it under my account, it was actually $38.
Insane. Insane.
And so that's what happens when you don't artificially inflate pricing, right? The lab wouldn't give me that quote or wouldn't give me that pricing if they couldn't still make a profit on it, right? But the delta, the difference in where that money is going, it's not all going to the lab when it's artificially inflated to $500+. It's going to the insurance company, right? They have to make their margin, right? And it's not just for lab work, it's also for imaging, right? I have a patient who had breast cancer, and the oncologist or the cancer doctor wanted MRI rather than mammogram to follow up and surveil the tumor. Well, when she first started doing this about 3 or 4 years ago, they had to compromise and alternate between MRI and mammogram because insurance said it wasn't necessary. And so the insurance would cover mammogram, but she had to pay $2,000 to $3,000 out of pocket for the MRI. The same imaging center, I'm able to get that MRI for $600. So now that patient can get what her oncologist wants, the MRI, every single year at a fraction of the cost that she was trying to alternate every other year and compromise her care. And it's sad that the oncologist can't just order for the patient to get it done, right? Yeah. I have to work with that oncologist and make sure that they get the results, but the orders have to come from me because I've taken that extra step to personally negotiate pricing with local imaging centers. But yeah, so that's just a little peek behind the curtain for some patients about insurance really belongs as a safety net. It shouldn't be gatekeeping or pretending to be your only access to care, right? There's other ways of doing this. And it's not just my practice. There's over a dozen practices in town that do this direct primary care model. Problem is, most of them are full. They don't have a lovely assistant like I do, Shaylin. They're by themselves. They're capping out around 300-400 patients. Between me, my wife, and Shaylin, we can handle probably 750-800 patients. And every patient is unique. So every panel of patients is going to be unique too. And so I don't know if that's going to be 750, 850, 800. I'm just projecting out there. And honestly, the healthier the patients get, the more capacity we'll have. And once we run out of capacity, I'll build a wait list and I'll hire another doctor. I know there's so many out there that love this style of medicine. They're just too scared to do it, right? It's a big leap of faith, especially when you go into a lot of debt to get through medical school, especially when you've got a young family and bills to pay. And yeah, it's a lot of uncertainty about the success of a practice, but I'm happy with how well it's going.
It's almost difficult to not have the mindset that the current health system is kind of just set out to keep you sick.
Yeah.
Yeah.
And I mean, to a certain degree, that's true, right? When you're paying clinics to see you, the more often they see you, the more they get paid, right? And also this value-based care stuff, the sicker the patients look on paper, the more you're reimbursed, right? And I can understand the mindset of it, right? Like seeing a patient that is completely healthy and is just there for like annual blood work and a vaccine is completely different than juggling somebody that's got heart failure and kidney failure, and you're balancing and tweaking medications, plus they've got a new diagnosis of diabetes and stuff. Like, they should pay differently, right? And so I understand where that's coming from, but what's happening is these really big companies like Optum or United Healthcare, I mention them because that's the experience I have. They know how to play the game. They can leverage it, right? They can spend millions of dollars on medical record systems to track all the minutia and play the game and upcode and diagnose and get all of these diagnoses that the average doctor would ignore year over year, right? And when Medicare agrees to pay that, well, that's coming out of taxpayer dollars, right? And so that's how they are now one of the wealthiest companies in the world and employ 10% of all doctors, right? And that is absurd to me, right? As a doctor, what I would think is I need to diagnose and code the things that we're actually talking about today, right? And if there is something like their blood pressure, for example, that's been stable for like 10 years or whatever, and I'm just refilling their medications, I don't know that I would necessarily need to say, oh, they've got hypertensive kidney disease or something like that. I would just think about it if I'm addressing the actual kidney disease, right? If I'm making dietary recommendations, if we're adjusting a medication for it or something like it. But these sophisticated computer systems will have it suggest these codes for you to use based on their history and reviewing their stuff. And they're just playing this game that is unfortunately necessary to be a successful medical practice, but at the same time, it has such a disconnect between actually caring for patients, right? And it adds additional administrative burden to docs that can't even get to the patients when they need to be getting to the patients. So that's a freaking shame. But that's why people can feel like, hey, the healthcare system is just here to keep me sick, right? And unfortunately, there's big money in that, right? Big pharma. Right? If food is medicine, right? Why aren't the farmers markets rolling it in, right? But you can't patent lettuce, right? You can't patent vegetables. There's no money to be made off of that, right? And so when you look at trying to get at least to like metabolic disease, right? We're talking blood pressure, cholesterol, diabetes, causing the leading causes of death in America, heart attack and stroke, right? So much of that is related to your nutrition, right? But it's easier for patients to just pop some pills, right? And then when insurance companies and big pharma come together and negotiate on all these prices, right? It doesn't matter that you can get the pills for 2 or 3 cents per pill. Big pharma is raking in way more money from the insurer on it. And you see these interconnected pieces. And it should, in my opinion, it shouldn't be legal for an insurance company to own the pharmacy, to own the person it's called the pharmacy benefit manager, the person that's negotiating the prices on the drugs. They shouldn't own doctors that are writing their own bills that they themselves are paying, right? But it's this trend of vertical integration, right? And that may make sense if you're manufacturing like aluminum cans or something, right? Or you're manufacturing some type of machine parts. But when it's a public service, when it's people's health and livelihood, that's not okay. It's not okay to just steamroll everything and streamline and fix every little price. Meanwhile, you're cranking up the profits on the stock market, right? Like that's just not okay. And so that's part of the reason why the U.S. healthcare system doesn't have as good outcomes as some of the other places that have universal healthcare, which is a whole nother topic. Right?
Yeah, it just really does sound like a big conflict of interest. You're definitely right there. They shouldn't be under the same roof.
So what message do you have for folks in Eugene about healthcare when it comes to whether it's traditional or it's direct primary care? What's the message you have for people in our community when it comes to healthcare?
Yeah, that's a great question. There's a nationwide physician shortage, right? Accessing care is really tough. You have to advocate for yourself. Like you have to get after it. If you or a loved one is struggling to find primary care, there's a resource on the Lane County Medical Society's website. And so you just get on Google, search Lane County Medical Society. It's right there up front. It's a PDF. I actually helped compile it. It's a list of all medical practices, primary care practices in the county that are accepting new patients. It was last updated in June, so it's not constantly updated, but that's a great place to look. What I want the community that's listening to this podcast to know is that if you're self-employed, if you're a small business, if you work for a nonprofit, or you know people that any of that applies to, there's a really good chance that you're uninsured. There's a really good chance that you are just hoping and rolling the dice each day that nothing major happens, that you don't have any chronic condition that's undiagnosed or anything like that. And it's a shame. And so direct primary care is the solution for those people. And for those people, rather than the national average of $550 a month for a high deductible plan, they can get direct primary care ranging from $80 to about $150 a month. And they can pair with that a nonprofit catastrophic safety net plan, which also ranges from about $80 to $250 a month. That would limit their out-of-pocket maximum if they were hit by a car and it was a hit and run, or they had an accident while they were skiing or snowboarding and needed surgery, right? It would limit their cost to anywhere from $1,000 to $5,000, rather than, the leading cause of bankruptcy in America, medical debt. Right, you need that knee replaced, or you need that an ACL repair, and there's a complication, like it gets infected, and you're in the hospital for a week. You're talking almost $100,000 for something like that, and it's ridiculous. You're talking a cancer diagnosis. Each treatment could be $20,000, and you need 2 treatments a month, right? And so direct primary care alone is not the answer. You still need some sort of safety net, and so that's. The takeaway, the take-home message is that everyone can access care, and anybody that is working and that has some income, if you can set aside $100 to $200 a month, you can access full spectrum care.
That's a great message. That is the message. Make it's accessible and affordable.
Yep. And available.
Right. Are you taking on patients right now?
Yeah, absolutely. So we are 10 months in and have 250 patients, 252, 253, something like that. So we're about a third of the way full.
Yeah, you can handle up to 3,000, right?
No. But yeah, aiming for 750 to 850,
That's
somewhere
great.
around there, and have plenty of capacity to help. And there are other doctors in the pipeline that I'm helping. And that the whole community of direct doctors are kind of helping to cultivate this new mentality. I feel like if we can keep older doctors from retiring, just say, hey, how about you have 10% of the patients you currently have, people that you've known for 20, 30 years, and you do online, office hours or whatever, and work 1 or 2 days a week in the office and live your life, enjoy your grandkids, and balance that out because medicine is part of their identity. Maybe we can keep those guys from retiring. And so maybe not every doctor needs to have 3,000 patients, right? What would that look like if we had people that didn't turn over so quickly or leave? So yeah, that would be great for our community.
What an opportunity.
Yeah, that's awesome. So how often should somebody see the doctor? I mean, I think, I've always been under the impression, you see a doctor once a year, do the little checkup thing, and then you're gone. Right?
Yeah, so that's a great question. I suspect that has something to do with insurance, similar to why you can only get prescriptions for 90 days, because there's some backroom deal that was made to drive traffic to the pharmacy, right? If you're on a medication for 10 years, why can't you get 365 pills at a time? Like, it doesn't make sense. Why do you have to keep going to the pharmacy over and over and over again? And I suspect it's pretty similar with the doctor's offices, right? And patients get trained to expect a physical or a wellness visit or something where they're filling out questionnaires, checking boxes for the doctor's office to submit to insurance and say, hey, we're still seeing this patient, right? Or that they get a panel of blood work, right? That cholesterol I was talking about, the blood count I was talking about, the blood sugar, liver, and kidney panel I was talking about, that annual panel of blood work. I had so many patients that are just used to getting that blood work every single year. Maybe they're healthy. Maybe they don't take any medications. Maybe it's been normal for 15 years. I don't think that patient needs it every single year. On the other hand, maybe you've got a diabetic. Maybe you've got somebody with blood pressure issues. Maybe there's some kidney disease. Maybe you need to do it a little bit more often than every year. Right? So that's a complex way of me just saying every patient is unique, right? In my opinion, and the way I try and run my practice, When patients first come in, our first visit is about setting expectations, learning about where their health has been, where it is, and most importantly, setting goals. Where do they want it to be? What does healthy look like to them, right? And then we order the blood work, we order whatever testing we need, bring them back, do a baseline physical so we know what their health looks like, catching any, cardiac murmurs, or if they've got frozen shoulder and they can only lift it this high, documenting that sort of stuff, right? And then they get physicals whenever they need, whenever something is acting up, whenever something just feels off, right? Then you can get in and you can get examined. But doing the physical every single year, you're not really necessarily going to catch something. Similarly to blood work, like if you're healthy and in good health and you have these healthy habits and you're not taking a bunch of medications or things that risk liver injury or kidney injury, it's kind of like shooting in the dark for everybody. And I think it's something that has been commonly and widely accepted because insurance pays for it effectively.
Sure. So let's talk about when somebody does go in for one of those routine physicals, right? Just go in, doc, just run me through the thing. Let me just do the thing, check the boxes, that sort of thing. And how important it is for the patient to share about odd things that are happening, even if they're not prompted to.
Yeah. I think first and foremost, if there's something going on with your body that you don't understand, who else should you be talking to than your doctor, right? We're very quick to get on Google, do our own research, all that sort of stuff. But your doctor should be the person that can answer that. Is it something worth worrying about, or should you put it out of your mind, right? Those types of weird things, whether it's, I get this rash that kind of comes and goes and, I've been doing this and I don't know if it's working or helping, right? Those are the types of interactions that are great for docs. The problem is when people are set up for their annual physical or when they're set up for a preventative visit, insurance doesn't cover for you to talk about anything other than doing the physical or talking about your vaccines and your cancer screenings and that sort of stuff. So when you start bringing those things up, the doctor may do one of two things. One, cut you off and say, hey, you've got to schedule a follow-up visit so we can discuss these things. Or two, they may just submit 2 bills to the insurance. And because they're checking these boxes, and it's not just the preventative care boxes. It was about this wrist injury that you had a week ago. It was about this eczema that I think you may be experiencing. Or, you had a really bad flare in your asthma, and we talked about allergies and that sort of stuff. It's not covered by your insurance to do that during a physical or to do it during a preventative visit. And so it blindsides patients and they get these surprise bills and they're like, I don't want to talk about this again. I'm not going to bring it up in front of the doctor. I thought this was covered and now I got a bill for $200 or $250. And so I think probably a lot of people listening to this podcast can experience or have experienced those sorts of things. And as a doctor, it sucks. I mean, either way, you're clicking the wrong boxes and you need to try and support the running of the practice. And if you budgeted 15 minutes for a visit to just go through preventative screenings and now you're spending 30 because they had some questions, it's pushing back the rest of the clinic and it's not generating revenue for the practice if you don't click those boxes. So there's all this mental gymnastics that doctors have to go through that have nothing to do with taking care of patients. In 15 minutes, right? A lot of the doctor schedules are set up in these 15-minute blocks. You're supposed to check in through the front desk, get your vital signs done by a medical assistant, tell the medical assistant what you're doing, fill out a couple of questionnaires like around mental health or other things like that. The doctor's supposed to go into the room, listen to you, plus or minus examine you, develop a plan with you about what to do next, order the prescriptions or lab work or imaging or whatever, place the appropriate referrals, explain to you the pros and cons of how to, why you're going to make that plan together, give you a printout of what you discussed, write a legal document or your medical note about their medical findings during that visit, and do all of the clicking of boxes and coding and billing for that visit in 15 minutes.
That sounds like insane. A lot of stuff that you just mentioned.
Don't forget anything,
And so, my heart goes out to patients when they're like, my doctor didn't even look at me.
Right.
They're just looking on the computer, clicking all of these boxes, all of this sort of stuff. And when they don't feel heard, when they don't feel listened to, I try and remind patients that it's not the doctor's fault, right? It's the system that they're trying to operate in that is just so fundamentally flawed and broken that they can't have those personal connections that I think a lot of people crave.
And insurance was what ruined it.
I think, you don't ask your mechanic to run your auto policy when there's some noise under the hood, right? When the plumber comes by because you got a leak, they're not running your homeowner's policy, right? Your disability insurance, your life insurance, all of these things are for catastrophe. And over the last 30, 40 years, we've been brainwashed to equate health insurance with health care. They're not. They're very different. Health insurance is this safety net, this funding source, but it's not the actual care. And so those are getting more and more disconnected, and more doctors are getting disheartened and frustrated with how they're being told to do their job and the artificial limitations that are being put around how they connect with patients and how they care for people. And so I think we're over the next 10, 20 years, I'm hoping we're going to get this regression back to old-fashioned principles and just caring for people, getting back to basics.
How does it make you feel to be a part of that?
Great. Oh, so good. Yeah. I mean, back in my previous practice, all those mental gymnastics that we've been talking about, it doesn't feel like you're able to provide the type of care that you want to do, right? And I'm fortunate in that I moved across the country for the pandemic, right? I couldn't see my family if I wanted to. Right? And I didn't have to worry about exposing them to things or anything like that. And so when patients needed extra time, I gave them extra time. But what did that mean? That meant that my last patient was at 4:30. I was getting home at 7 every day. I was working 4 days a week, but my weekends, hours. My day off of the week, hours. Just clearing up stuff on the computer, clicking different boxes and filling out administrative stuff that wasn't important, wasn't directly translating to patient care, which is why that grocery store run, incredibly fulfilling. 30, 15 minutes of my weekend, as opposed to hours finishing up notes, I would take that in a heartbeat, right? And so being able to let some of that go and just focus on building my practice and moving the movement of direct care forward and bringing it into our community, it feels passionate again, right? Instead of going through the motions, getting visit by visit, the work never ending, having this revolving door of sickness that you couldn't ever feel like you get through, to now having those relationships with patients, right? If I have to see them every other week or if I have to see them every month to get them healthy, then they come in for like social checks and just like, hey doc, I wanted to say hi. I wanted to tell you like how well everything is going. And, they may have a question here or there, but that part is also really rewarding.
Alrighty, everybody. So we're to that part of the show where we get to know our guests a little bit better. So Nick, are you ready?
I am ready.
When you're not at work, what do you like to do?
Oh gosh. So I am on a volleyball team. So I play volleyball every week. I am also in a basketball team. Play basketball every week. I love being outdoors. So depending on the time of year, in the winter, I'm snowboarding. In the rain, I'm rock climbing at elevation. In the sunny weather like this, I'm trying to mountain bike, get out on my bike.
Nice.
And when I'm exhausted, I'm playing video games on the couch in front of a big TV.
Sick.
A lot of that. See, that's all preventative care.
Yeah.
Right?
Yeah, absolutely. Whenever you're mountain biking or even snowboarding, where do you like to go?
We're so lucky out here, right? I moved from Texas, and there's 2 seasons, hot and hotter, right? But being able to go an hour and a half, play in the snow, and come back and not have to shovel it, so great. So
not have to shovel it.
Between Hoodoo and Willamette Pass, such great spots.
And affordable.
Yeah.
You can do it in a day. You can do multiple in a day.
Well, I mean, it's an hour and 15 minutes to Willamette Pass and an hour and a half to Hoodoo. And, even if I go with family that are visiting and they're like, I'm not getting on a snowboard, I'm not skiing. Well, put on some snowshoes. Ray Benson Snow Park right there outside of Hoodoo. It's an awesome place. You chill, and I'm going to go hit the slopes.
Yeah, I'll be back.
That's what's cool is you can go take an hour, go to the mountain, then in the morning, and then in the afternoon, drive to the coast for an hour, and now you've just experienced 2 very different climates.
I will mention, coming from Texas, I did my residency in Corpus, which is on the Gulf of Mexico. There is a reason we call it the coast and not the beach,
Oh,
right?
yeah.
I was expecting a beach when I showed up in flip-flops and sandals my first time going to the coast.
Yeah.
And then I realized, no, this is something you enjoy in pants and a windbreaker and some layers, even in the summer.
Absolutely.
Yeah.
Absolutely. That's so funny. We make that mistake every single year, and we know better. What was the first career you dreamed of? Or was it always medicine?
No. I was being serious. I think it was Spider-Man and then astronaut and then medicine. Maybe pilot thrown in there a little bit. I could probably call up my mom and ask what the order was.
Did you do anything with any of them?
Anytime this was way back in the day, I hope they still do it, but whenever we would take a flight, my parents would let me go into the cockpit or like, I think especially I remember Southwest, and we'd get these little pins, and it would be like every time you talked to the pilot or met the pilot and they showed you the cockpit, they'd give you like a pin. And I vividly remember doing that multiple times. I also did that with some train conductors, though I never wanted to be a train conductor. Flying is way cooler.
I feel like it takes too long. That's wild.
Yeah.
I don't think that they do that anymore.
So nothing with the Spider-Man one. I was really hoping you were gonna say, well, I did dabble in superheroism for a little bit, but
I have met Stan Lee twice. Before he passed. Yeah.
Oh wow, that's incredible.
And I have a couple of comic books that are signed by him too. First Spider-Man comic I ever read was Ultimate Spider-Man. Came out in 2000. And sure enough, I had him sign the first copy of the first comic book I ever read.
Wow.
Or Spider-Man comic book I ever read. And then first appearance of the black suit Spider-Man, right, when he went through his dark phase.
Right.
Had Stan Lee sign that too, and those are some of my prized collections for sure.
Legendary.
Wow.
That's so cool.
That's badass.
So reflecting on your past, and you kind of did this a little bit earlier, but what is the earliest memory you have of healthcare?
Oh, yeah. I did address that before. Yeah, I mean, I remember being really sick in kinder, and like in residency, I never took a sick day, right? In medical school, never took a sick day. Like, I just didn't get sick. I like to thank my immune system from being a gross kid. I probably ate bugs, ate mud, might have swallowed a few coins here or there, who knows. But I was pretty sick back in kindergarten, and I remember my parents coming and picking me up. And I don't know if it was just that I felt better or I could sense the body language from my parents feeling better.
Oh, sure.
But once that doctor saw us, I knew it was going to be better. And so I might have been 6 years old, something like that. But I realized, because I was all into dinosaurs, all into space, I liked science, I knew that was something I wanted to do, and so did my parents. And so whenever the opportunities presented themselves, whether it be in middle school or elementary school or whatever, and there were opportunities, they would try and hook me up with doctors or try and shadow. And there was this medical school outreach program trying to get more Hispanic doctors, because there is a disparity of people of color becoming physicians. And so I was able to get into that. I may not look it, but my surnames would be like Villalobos Zaragoza Ramirez Jones. And so I do speak Spanish. I grew up on the Mexican border.
Awesome.
And so I was fortunate to have those outreach programs, and I actually got early acceptance to medical school. I got accepted to medical school straight out of high school. And I just had to get a certain score on my MCAT, a certain GPA through college, and I was guaranteed acceptance. And I did that for 3 medical schools and chose San Antonio.
Fire.
Yeah, I'm a big Spurs fan. So.
Dude, so question for you. So growing up, so we moved up here when we were really little. We used to live in Mexico. So whenever we moved up here, I started going to school and I learned how to speak English, but then I was a family translator. So I was getting dragged to all sorts of doctor's appointments all of the time to translate for my parents, my aunts, my uncles, my grandparents, and everybody. How often do kids do that?
Yeah, it's definitely frowned upon.
Really?
Yeah, I mean, sometimes it's a necessity, right? But there's professional translators out there for a reason, right?
Now.
Now. Very good point. And they even have like telehealth, like where you can bring in an iPad and stuff and do that, right? And so for me, even though I speak Spanish, if I'm explaining a cancer diagnosis or I'm explaining like some potential side effects for pretty heavy surgery or medications or something like that, I'm going to lean on my translators, right? I'm going to make sure that the patients fully understand everything that they're asking. But, you do what the patient needs with the resources that you have. And so some clinics may not have access to a translator. And especially before the pandemic and the preponderance of telemedicine, you're pretty limited to the people around you. And so, I mean, it's something that's done, but not preferred.
That's a good question.
Yeah.
I always wondered about that.
Did you?
I mean, I knew it was a thing. I just didn't. I didn't grow up that way, so I don't know. But
First generation immigrants, man,
Yeah.
and second generation immigrants, having kids that can help bridge the gap, and there's sometimes personal topics that you got to talk about, right? And it can be uncomfortable, and so making it so that patients don't have to shoulder that burden, especially if like telehealth can cost $1 a minute or something with a Spanish translator. Like, there's no reason not to nowadays. And don't even get me started on AI. And these things, you just set it down and it'll start translating for you. And it's not perfect, but it's better than having your hijo or
Your
whatever.
7-year-old son there.
So you were talking about a podcast that you were listening to. So are there any podcasts or books that you're really into right now?
Oh gosh, I don't know that I'd say right now, but when deciding to leave my old practice and my security and like jump off the cliff, so to speak, there's this awesome podcast series called My DPC Story, My Direct Primary Care Story. Marielle Conception, she's out in Northern California, and it is awesome. There are literally hundreds and hundreds of episodes of doctors just sharing their personal story about what their background was, what pressures they felt to leave medicine, and why they found direct primary care or direct specialty care. So you'll hear from dermatologists or rheumatologists or neurologists, all these different people that have found this kind of model, and every single practice is different, from how they charge to how long they have patients sign up for, whether or not they charge enrollment fees, like all these different things, and they tie it back to their own personal experiences. So it's super inspirational. And so in case there's any doctors out here listening, that is an awesome podcast. But another one for non-doctors that I really like is anything from NPR, specifically NPR Life Kit. That stuff is awesome. Anything from like personal finance to parenting to health. They always bring on experts to give their opinions on things and talk about the latest research, and they break it down at the end of the podcast. Here's like 5 points of this, and this. Those are the takeaways. That one and Shortwave on NPR. They do a great science podcast every day. I listen to that. It's maybe 10 to 20 minutes in length, and they cover really neat topics.
Oh yeah, that's awesome. What's the best advice you've ever been given?
Oh gosh, that's a really good one.
An apple a day keeps the doctor away.
There's some truth to that, and we can maybe bring me back and we can talk about fiber. But I think I always lean back on my grandfather. My grandfather was is an amazing human being. He's about to turn 90 on Halloween.
Wow.
And he's still walking miles a day.
Wow.
And he is also very religious, but for some reason it comes to mind where he would always say, tell me who your friends are and I'll tell you who you are. Right? Just again saying that the people that you're surrounding yourself with are a reflection of who you are, and you're a reflection of the people that you're surrounded by. And so in coming across from South Texas and moving to Eugene and not knowing anybody, it's been really awesome, like picking and choosing our found family and building up the network of friends and neighbors and people that we keep in our lives. And it's really cool. I notice we have a lot of similarities, and fostering those and strengthening them has been really nice.
No, I love that. I remember when I heard something very similar and actually took action to be strategic about the people that I bring into my life. I realized that it just, because I was very friendly. I was just friends with everybody.
Yeah.
And I was like, man, you know what? I could do without you. But or I could do more with you, you know?
Yeah. Both sides of the coin.
But yeah, that's good. So.
Well, I want to finish this off with a question that I love asking everybody, because everyone has a unique answer. And because you're kind of new to Eugene, this will be fun. So what do you think is a hidden gem in Eugene? It could be a restaurant, a retail establishment, a park, a historical site.
How hidden are we talking?
It's hidden to you. It's something where when you discovered it, you're like, whoa. if somebody comes into town, I'm going to just take them here, or I'm going to show them this.
Yeah. So, great shout out opportunity here. The Coconut. I don't know if you guys have heard of this spot. It's off of Chambers. It is amazing. So I'm really passionate about lifestyle medicine, and a big part of that is eating a whole food, plant-based diet. Whole food meaning not processed, plant-based meaning it's mostly plant-based stuff, right? It's a way better term than vegan, right? You could eat French fries, Skittles, and Sprite all day and be vegan, right? That's not what whole food plant-based means. But I don't know about you, but when you cook, anything with butter, anything with bacon, that sort of stuff is going to be delicious. It doesn't matter what you're putting it on, right? The skill is really in making something that is fresh and tasty and fulfilling that is whole food plant-based, right? And it is so hard to find places that do that. And the Coconut does a phenomenal job. And they change their menu once or twice a month. And I just had them today for lunch. They also do a soft serve that is like different. It actually has protein in it because it's almond based. And they have they change that flavor every day. And it is like some of the best soft serve I've ever had. And it's healthy and it's whole food plant based, which is so good. And I've taken my parents who do not eat that way there before. And my mom was like, I've never had something so filling. Like, I did not think about food for 4 to 5 hours after that meal, and that never happens. And that has to do with the fact that it's not processed, it's not engineered to make you hungry and go back for more, right? And it's all fresh and delicious, and I hope more people out there find it. It's a mom and pop shop in town, and I love it. I think it's on Chambers and 11th.
Coconut,
somewhere
Chambers
there.
and 11th.
Awesome.
Yeah. I know you said it changes monthly, but do you have a favorite dish?
Oh, the mango ceviche tostadas.
Oof.
Oh, they are so good. They use coconut flesh for the protein, and the tostadas are made out of flax seeds, so they're kind of heavy and substantial. But then you've got this fresh avocado and mango, which lightens it up. Obviously, they've got some type of secret sauce on there, but it is healthy. It feels light while you're eating it, and then kind of like my mom mentioned, you just don't think about food for a while. It's not like, oh, I got to loosen my pants,
Yeah.
right? But it's just, fulfilling. And then you cap off that with some soft serve. Ooh, great meal.
That sounds amazing.
Well, we're gonna link to that in the show notes so other people can find out. Because
Sweet.
That sounds like a really cool place to check out. So, well, hey, Nick, thank you so much for coming on to this episode and sharing with our audience about your practice and where they can find healthcare that's affordable and accessible and personal.
Yeah. Thanks, guys.
What a great interview. I love the fact that you guys were talking about kind of this like old world medicine, or at least this old world of healthcare, where you kind of have this more personalized way of healthcare, where they're on call to some degree. There's no concierge service here, but being able to, if your kid's sick, talk to the doctor right away.
Yeah.
Text message, phone call, iPad. Or going in the next morning, right?
Yeah.
Instead of having to schedule out, several days or weeks or months. So that's fantastic.
Yeah, and then literally, it reminds me of just growing up. My grandmother would be like, "Oh, we need to give you a shot. You're cold or whatever, or you have a cold or whatever," and straight up would just call the doctor, who lived like a block and a half, and the doctor would come over with his like little medicine bag and stethoscope and everything there, and I'm just like, whoa, like wild. Well, actually, back then I didn't even say whoa. I was just like, okay, this is normal. And then we came here, and it was not like that.
Yeah, it's not even nothing close to that.
Yeah, and it's just crazy because healthcare is supposed to be there for the people, and staying healthy. If anything comes up, go to that. But I think like right now with the system that we have, a lot of people really only use healthcare when they really need it.
I know, and I think that's one of the awful things to think about, is that you just don't go to the doctor till it's that bad.
Absolutely. And
he's talking about this preventative care. He's talking about catching things early, because one of the things we talked about is that insurance companies kind of want to keep you sick, which is just awful. And it's like, I love that he's here in this community, providing that to everybody.
Yeah,
that's great.
Yeah, I think it's just really eye-opening to see that, if somebody's clinic wants to start accepting insurance, like you'd almost need to hire a full-time person just to do that insurance documentation and, you know, checking of boxes while you have the doctor focusing on that. You know, if you're a one-man show, you trying to create those relationships and then follow up and do all of the documentation, all that, you know, it's not possible.
Yeah,
so this is where it starts losing that personal connection. It's just really neat to see them pull from that.
And I liked how he gave a solution like right away, which is like, you know, hey, if this is something that is of interest to you, you get this, and then you have this backup of like, if anything catastrophic happens, you got the safety net there. So it's not like this or that. It's like, here is kind of this all-encompassing way to care for yourself. Yeah,
it's a full-on package, and you know, I think that if employers start offering something like this to their employees, this is a huge benefit,
right? And
it's really not that crazy priced.
No,
like really, how much are you paying for other subscriptions? And that at $100, anything that happens, you can just pick up the phone and reach out. Sending a text is crazy. You know, everybody's working, everybody's just moving so fast. So just the ability to do that, insane. You know, right now, if I try to call my doctor, I get some head nurse, and then the head nurse takes a message and reaches out, and then they're like, oh yeah, come back in 3 months. You know, well, what if something happens between now and then? So that's insane. And one thing that was really insane too is like the amount of patients that they work with.
Oh man,
you know,
I had no idea. Like over 2,000 patients.
No wonder my doctor never remembers my name.
Right, exactly. That's crazy. And so he's talking about, oh yeah, like 600 is really what we're kind of aiming after. And it's like, wow, that is such a big change.
Yeah. No, absolutely crazy. So it's just really neat to see this kind of practice here local for us and available. I really hope that, you know, they get as far as they're trying to grow. So.
Absolutely, and I think this is going to be a great resource for everybody in the community that is looking for healthcare. So,
alrighty, well, thank you so much for joining us today. That is all we have for you. We'll see you on the next one.
This episode of the Eugene Morning Hustle podcast was brought to you by the Eugene Area Chamber of Commerce and sponsored by Ivan Torres of Business Block Studios and Brandon Miller Voiceover. Don't forget to subscribe to our channel where you get your podcasts and follow us on Instagram, Facebook, and LinkedIn to stay in the know. If you have any questions, topics, or guests you'd like us to dive into, send us a voice message on the Eugene Chamber Instagram page, and we'll feature you and your question on a future episode. Or shoot us an email at podcast@eugenechamber.com. Till next time, Eugene.